Kathy Kino is a breast cancer survivor and living proof that blood donations save lives. It all started with a regular trip to the doctor for an annual mammogram and ultrasound checkup.
Dr. Sandra Sanchez, who's the surgeon, called me and she said, "We just got the report. It's not what I had hoped for, but it's cancer and you need to prepare for a mastectomy."
After the difficult news sunk in, she approached the situation with a positive outlook.
I just said, no, cancer is not going to beat me. My mom got everything together and picked up my son from school for me, and I explained to him a couple days later kind of what happened.
Just thinking about her going through that just hurts, because I didn't want anything bad to happen to her.
I had 65 staples just all the way across my chest, and I just knew that God had a plan for me to be used to show other women that they do have a choice, that they don't have to have breasts to define them.
But her troubles didn't end there. Just a year after her cancer diagnosis, doctors found several tumors in her abdomen. Once again, she found herself on the operating table.
They took out everything in my abdomen as far as the ovaries and uterus and the tumors. And what was supposed to be a one-day stay in the hospital ended up being 10 days.
Kathy began bleeding internally and required 8 pints of red blood cells and platelet transfusions to survive.
The red cells are critical because they do carry oxygen from our lungs to our tissues and then carbon dioxide back. The platelets are crucial in helping prevent bleeding that is occurring.
Once I got home and I started recovering from the surgery, I thought about everybody. Who were those people that donated for me? And if I knew them, I would write them the biggest letter, or I would want to see them and thank them.
Many cancer patients like Kathy require blood donors to sustain their life.
I would say that without blood products, I could not treat my patients the way that they could and should be treated.
By doing something selfless, like giving this blood to the patients, it's something that we ourselves are not able to provide, and without their help, it wouldn't be feasible.
I think people should donate even if they don't know the reward of what they're doing. Just saving one life could change a whole family forever.
Today, Kathy is a mom, university professor at Palm Beach Atlantic teaching nursing students, and a chaplain. She hopes to inspire others with her story to save lives by donating blood.
Just thank you from the bottom of my heart for taking the time to give and for blessing me so that I could still be here and be a mom to my son and to be a professor and to be a chaplain and to make a difference in people's lives. That's my purpose. I just want to share the message so that others know how important it is to donate.
For OneBlood, I'm Stephanie Zorin.